Hello friends, this is Vaishali Pawar, lecturer from Abhinav College of Pharmacy, Pune. So today I start new chapter, that is drug acting on central nervous system. Central nervous system consists two main parts, that is a spinal cord and brain and spinal cord. The central nervous system control most function of the body and mind. In our body there are many neurons. The neuron contain cell body, dendrites, axon and axon terminal. This is the image of neuron. So main function, neuron is a functional unit of nervous system, can send and receive the message in the form of electric current called as nerve impulses. So in our body there are many neurons which are connected to each other like an electric circuit. The axon terminal of one neuron is attached to cell body of another neuron. The space between two neurons, it is called as synapse or synaptic cleft. And many neurotransmitters are released at the axon terminal on the cell body of another neuron. On the cell body of another neuron, there are many receptors and the neurotransmitter which are released from from the axon terminal get attached to the receptor which are present on another cell body of another neuron. So, five main neurotransmitters in the brain are acetylcholine, noradrenaline, serotonin, dopamine and GABA. The drugs acting on CNS are either agonist or antagonist of receptor of respective neurotransmitter. In previous lecture I told that definition of agonist and antagonist. Agonist means these are the drugs which show pharmacological action when acting on respective receptor. But antagonist does not show pharmacological action, they block the receptor. Our main chapter is general anesthetics. In this chapter I am going to discuss about introduction of general anesthetics, stages of anesthesia, classification of general anesthetics, properties of ideal general anesthetics, use of different general anesthetics, advantages and disadvantages of general anesthetics and pre-anesthetic medication. In today's lecture, I will going to discuss about introduction of general anesthetics and various stages of anesthesia and properties of ideal general anesthetics. So, what is anesthesia and what are anesthetics? There is a different meaning of anesthesia and anesthetics. Anesthesia means reversible loss of sensation. There is a loss of sensation, it is called as anesthesia. And anesthetics. Anesthetics means the agent which produce anesthesia, that is reversible loss of sensation. Anesthetics means the agents which produce anesthesia. Then there are two types of anesthetics, that is general anesthetics and local anesthetics. General anesthetics means the drug which produce anesthesia all over the body and there is a loss of consciousness, whereas local anesthetics means the agent which produce loss of sensation at a particular area without loss of consciousness. Let us see the definition. General anesthetics means these are the drug produces reversible loss of sensation all over the body and also loss of consciousness. And local anesthetics means the agent produce loss of sensation at the area of application without loss of consciousness. It is called as local anesthetics. So let us discuss about general anesthetics. First, definition. These are the agents which depress the CNS and bring about reversible loss of sensation and consciousness. So, general anesthetics drugs are the CNS depressant drug and they bring about reversible loss of sensation and consciousness. Important feature of general anesthetics are they produce loss of all sensation. Also, they produce unconsciousness or there is a loss of consciousness. Amnesia. Amnesia means loss of memory and immobility and muscle relaxation. All these properties are necessary for doing the operations. So it is used for many surgeries. So general anesthetics are the drugs which are used in many surgeries. Let us discuss about ideal properties of anesthetics. For patient, it should be pleasant and non-irritating. The anesthetics agent should be pleasant and they should non-irritating. They should not cause nausea or vomiting. Induction and recovery should be fast. Means the action of anesthetic agents and recovery rate should be fast. There should be no after effect, means there should not be any side effect of anesthetic agents. Then ideal properties for general anesthetics for the surgeon. It should provide adequate analgesia, means loss of sensation. It should causes immobility and muscle relaxation. It should be non-flammable and not explosive. And for the anesthetist, ease of administration, margin of safety to be wide, it should be potent, effective at low concentration, it should be cheap, stable and easily stored. It should not affect heart, lungs and liver. So these are the ideal properties of general anesthetic. The next part of our chapter is stages of general anesthesia. How the anesthesia is produced. There are different stages through which anesthesia is produced. There are 4 stages. Stage of analgesia, stage of delirium, stage of surgical anesthesia and stage of respiratory paralysis. So let us discuss one by one. The first stage, it is called as stage of analgesia. It is the first stage if anesthesia which began immediately after the administration of the drug and the patient remains conscious during this stage, can hear, see and feels a dream-like state. Analgesia is produced. Major surgeries or operation are not performed during this stage. Minor surgeries such as dental operation can be performed. This stage ends with loss of consciousness. Means in the first stage, the patient remain conscious and patient can see or hear and feel a dream-like state. Analgesia is going to produce. So that reason major surgeries is not performed in this stage. Only minor surgeries can be performed. For example, in the root canal and also for extraction of the teeth. These minor surgeries can be performed in this stage. It is stage of analgesia. The stage is end with loss of consciousness. When this stage is going to complete, then loss of consciousness is begin. The second stage is stage of delirium. It is the second stage of anesthesia which start with loss of consciousness. Excitation is produced during this stage. It is characterized by increased respiration, heart rate, blood pressure, and muscle tone. It is a difficult stage to manage since patient may move, salivate, shout, laugh during this stage. So no surgeries or operations are performed during this stage. This stage ends with starting of stage of surgical anesthesia, and the stage is not found with modern anesthetics. Means this is the second stage of anesthesia. There is a loss of consciousness, but the patient is going to excitation state, and it is characterized by increase in respiration, heart rate, blood pressure, muscle tone is increased, and the patient is move, salivate, shout, laugh. So due to this problem, major operations or surgery is not performed in this stage because the patient is going to excitation state, and this stage end with starting of third stage, that is a stage of surgical anesthesia. Stage 3 is surgical anesthesia. As the name indicate, many surgical operation is performed in this stage because skeletal muscle are relaxed, respiration is regular, vomiting is stopped, patient is immovable, respiration is depressed, and patient is unconscious. Due to all these reasons, the most surgeries are performed in stage 3. But if stage 3 is going on, then there are different plane or depth according to the depth of anesthesia produced. So there are different planes. Plane first. Plane first, there is a respiration is normal, eye rolls and then fix. Muscle relaxation is incomplete. BP and heart rate are normal. And after that, plane second is takes place. There is a respiration is regular, but amplitude of respiration is diminished. Corneal and laryngeal reflex are lost. Muscle relaxation is adequate. And then plane 3 takes place. There is a respiration is depressed further, and all reflexes are lost, and muscle relaxation is complete. BP begin to fall. And in plane 4, respiration is depressed and difficulty in breathing start. Reflex are already lost and muscle are completely relaxed. In stage 3, the respiration is normal, but if depth of respiration is increased and is going to plane 4, then in this plane 4, the respiration is going to depress and all reflex are lost and muscle are completely relaxed. And after this plane 4, stage 4 is going on, that is a paralysis of respiration. In this stage, if overdose of anesthetic agent is produced, then stage 4 is going on, that is a stage of respiratory paralysis. In this stage, skeletal muscles are totally flabby, pupils is widely diluted, and BP is very low. Due to this reason, there is a difficulty in breathing and patient is and failure of circulation and death of patient is produced. So many surgical operations are performed in the stage 3. In your question paper, previous question paper, the question is asked analyze the different stages of anesthesia and explain surgical anesthesia, means the stage 3, and also discuss the stage of general anesthesia. And second question is classify the general anesthetics with example. I will explain in classification of general anesthetics. I will explain in next lecture. Next question is definition of general anesthetics with example. So these are the previous questions of previous question paper. In the next lecture, I will going to tell about classification of general anesthetics. Thank you.